Quick introduction. My name is Saul Marcus. I am a naturopathic doctor in New York City, and I've been seeing people with Graves' disease since about 2011. The purpose of this video is to give practical information about Graves' disease hyperthyroidism with respect to medications and supplements, so people with Graves' disease and hyperthyroidism understand what they're doing when people tell them to take a medication or some herb. I'm trying to do something which is practical education for patients. I'm not trying to hype anything up. I'm not trying to sell anything. I'm not going to tell someone just take this one supplement and all your symptoms are going to go away. This is the information people with a serious disease need to know. This slide is really basic, but I've seen dozens and dozens of people who have Graves' disease over the last 6-7 years. And it is amazing how many times the most basics are not covered. And you go to YouTube and look at different videos and people are saying, oh, for Graves' disease, do this or do that. But everyone is different. You're not going to form a plan for yourself without looking at these basic questions. How bad are your symptoms? In terms of treatment options, there are medications. Do you need them? Well, how is someone going to even address that question if they don't even look at how bad are your symptoms? Yeah, I'm a naturopathic doctor. I love natural health. I love giving herbs and talking about diet rather than telling someone they should go take medication. But if someone's about to go into a thyroid storm, maybe they need medications. So how bad are your symptoms is going to guide the decisions upon what to do. Also, what is the cause of your hyperthyroidism? There's no such thing as one single cause of hyperthyroidism. It's a multifactorial problem that needs to be treated with an individual approach. Let's first talk about TSH, thyroid stimulating hormone. I have a whole other video a couple years ago just about lab tests, but I'm going to briefly go over it here because it's amazing how many people are told to take medications or just take a bunch of supplements for their gut or told to zap their thyroid with radiation without even being told what these labs mean. Thyroid stimulating hormone is produced by the brain, and it tells the thyroid to make thyroid hormone. So if you have too little thyroid hormone, TSH goes up because the brain is telling the thyroid more to make more and more thyroid hormone. If you have very low TSH, it means you have too much thyroid hormone. So you have lots of thyroid hormone, you don't need more, so the brain is going to stop telling the thyroid to make more thyroid hormone. I have in this chart different grades for severity of hyperthyroidism based upon TSH. If your TSH is less than 0.1, you're basically hyperthyroid. The reference range is going to go from 0 to 0.4. I put down in my chart here 0.1 to 0.4 as subclinical hyperthyroidism, although technically from a conventional interpretation standpoint that's also hyperthyroidism. The thing is, very few people are ever going to come in and see their TSH as 0.1 to 0.4. As soon as you see a little bit of elevation of thyroid hormone, as soon as you're just a tiny bit hyper, the TSH often goes all the way down to 0.1 or less. So just keep that in mind. Almost any elevation of thyroid hormone will cause TSH to drop all the way down to 0.1, or maybe it says 0.001 or 0.002 or something like that on your lab test. So TSH, for the most part, gives a yes-no answer to the question of, do you have hyperthyroidism? It is completely insufficient to use TSH to grade severity, disease progression, or response to treatment, because you're just getting a very simple yes or no answer. The person who is so mild hyperthyroid that they don't even hardly notice any symptoms is going to have the same TSH as the person who's running to the emergency room in a thyroid storm. You can't use this test to grade exactly where you are. You can't use this test to grade exactly how much medication or supplements or whatever you should take. So another lab test which is more useful is to measure actual levels of thyroid hormone. That's going to be T3. We can also measure T4. T4 is the less active thyroid hormone. T3 is the stronger, more active thyroid hormone. But this is actually the thyroid hormone. Again, I'm just going to say it again because people keep on coming to my office confused about this. TSH is not a thyroid hormone. It's a brain hormone. So what we see with T3 is a reference range of about 80 to 180. So let's say you want to know how much medication to take and your T3 comes back at 200. or 300 or 400. Let's say it comes back at 150. Is that exact number going to tell you how much medication you need to take? And the answer is unfortunately going to be no. Now, the test is helpful, but the problem is that one person might have a T3 combat high reference range like 160, and another person might have a combat 300, which is like 1.5 times reference range. Another person might come back 500, and you're not going to know how severe their symptoms are based upon this lab number. That's because different people have different sensitivities and responses to excess thyroid hormone. Doesn't make this a bad test. It should be run. Because hey, if your T3 is 400 and you do some treatment and 2 months later you go from that 300 to 150, you can say, oh, that treatment is working. But I don't know how bad your symptoms are because you're a 300 or 200, and no one's going to know. So you take the labs and you combine it with the clinical signs and symptoms, and that's going to be how you guide what to do. Other tests to guide what to do is to try to figure out what is the cause of your hyperthyroidism. There are multiple causes of hyperthyroidism. The most common of is Graves, and then within each of these causes there are subcauses. So we can say the 3 general causes of hyperthyroidism is Graves or autoimmune disease. There can be nodules on the thyroid that hypersecrete thyroid hormone even though there's no autoimmunity, or there might be acute inflammation from like a viral or bacterial infection, and all 3 of these can cause hyperthyroidism. So why you have hyperthyroidism is going to guide what to do about it. And the big test to know if you have an autoimmune disease is to look for antibodies. There are other antibodies out there, thyroid peroxidase, thyroglobulin, I didn't write down here, but the big one is TSI, or thyroid stimulating immunoglobulin. And medical doctors, the endocrinologist, if you're in a state that where you have licensed naturopathic doctors and they can order the lab test, they should be ordering the antibody test. Because not only is this going to help the initial diagnosis to figure out which one of these you have, but as you progress your treatment, and hopefully as you improve, if you do have elevated TSI, those antibodies should be calming down. And sometimes a medical doctor is going to say, well, we test the antibodies once, but once it's positive, we don't test it again because it doesn't come down. The antibodies can calm down if you work on your health and you get healthier. If you don't work on your health, and then it's probably not going to change if you just keep on doing the same old stuff. So that's what the medical doctors are thinking. They're just like, well, this isn't going to change because people don't get healthier, but you want to get healthier. You're going to take the steps you need to improve your health. So maybe your TSI is going to drop. Another test is a thyroid uptake scan. Sometimes we have more serious problems than Graves' disease, and we have nodules that just keep on hypersecreting thyroid hormone. If that's the case, you probably want to get this diagnosed. Now, a thyroid uptake scan, in my opinion, is probably not the first thing to do when someone comes in with hyperthyroidism and you're trying to diagnose them. However, in certain situations, it's a consideration. And then we have acute thyroiditis. It's not always Graves' disease, and if there's an acute problem causing inflammation of the thyroid, you want to be aware of that also, because you don't want to just overdose someone with medications, because maybe that overdosing can cause hypothyroidism. We're going to get into that a little bit later. Methimazole, also called Tapazole, is the most common hyperthyroidism medication used. I listed the doses that I see in my clients as low, average, and high. I'm not the prescribing doctor ever. I'm not an endocrinologist, but this is just my observation. And we're going to get into some of the intricacies of using methimazole, because I don't think patients really understand what they're taking, what it's doing, and possible dangers that can come from this drug. The big danger is that if you take too much of it, then it can induce hypothyroidism. Methimazole suppresses the thyroid's ability to make thyroid hormone, and unlike some of these herbs and supplements I'm going to talk about later, it doesn't just kind of lower or balance out hyperthyroidism, it will just keep on lowering thyroid hormone with the more that you take. So if you're taking this and your TSH starts to go up high, you need to be aware of it, and you need to tell your doctor you need to be retested. Like, remember, with optimal TSH is going to be like 1 to 2.5. If you're taking methimazole and suddenly your TSH comes back at like 3 point something, 3 4s, that means that you're already moving towards hypothyroidism. And what I've seen happen is medical doctors become very defensive because Graves' disease is a serious condition. So they'll give patients a bunch of methimazole, and the person is at first doing better, like their thyroid hormone is improving, but they're on a kind of a high dose. And then their TSH starts to increase. So their TSH goes from like 0.01 or whatever, then it goes to like 1 point something, then it goes to like 4. And the medical doctor is kind of cautious and doesn't want to remove the methimazole. Well, if your TSH is going up past 4, then you're moving towards hypothyroidism, and adjustments need to be made, because the next thing you know is a month later your TSH is all the way at 10 and you have no thyroid hormone, and all of a sudden you're hypothyroid, and it's hard to rebalance someone at that point. Then they have to discontinue the medication, and then their body has to start making the thyroid hormone on its own, which it can, but then when it starts doing that, you might be making too much thyroid hormone because you have Graves' disease. So you don't want to go back and forth between hypo and hyperthyroidism. So dosing is a key. Testing TSH while you're on methimazole is also very important. There might be someone who's on it for a long time and they know how much works for them. But if you haven't been using this drug for long, you need to have TSH monitored and make sure that you're taking the right amount for you. And of all the problems I've seen with methimazole, this overdosing, inducing hypothyroidism, is by far the most common problem, not the side effects. Now, there are potential side effects of methimazole. We can get low blood cell counts. It can inhibit blood cell production. That's a serious complication, but it's not very common. Hepatitis, jaundice, also it's teratogenic, so it's not used during the first 3 months of pregnancy. Or if a medical doctor believes a woman may become pregnant, then they probably won't prescribe this. There's another one we're going to get to in a moment that they will prescribe. It does come with a whole list of more common but less serious side effects, from skin rashes to nausea to vomiting, arthralgia, all this stuff. So it's not a medication people really want to be on, and there are options, alternative options we're going to get to a little bit later. But to be honest, from I guess my experience seeing dozens of people on it, it for the most part does a good job at lowering thyroid hormone, and I haven't seen many cases where people do have these side effects, but the side effects are out there and people can't have them. So it's not an ideal thing to use, but if your thyroid hormone is very high and you're in danger of having to go to the emergency room, this drug often works pretty well. So as a naturopathic doctor, I'm not against the use of this drug. I am against the use of this as a monotherapy without looking at anything else and just hoping the thyroid balances itself on its own, which is the conventional plan. The conventional plan is, we don't know what's causing Graves' disease, so let's give someone this drug that's going to suppress the thyroid hormone, and hopefully they can get off of it someday. But we don't know what to do to help them so they can discontinue it. We don't really know what to do for the cause of Graves' disease, so let's give them this drug and pray. That's really what their plan is. So I'm for methimazole when people need it, within the context of a plan to get healthy. The two other medications you'll commonly see used is going to be blood pressure medication, usually propranolol. That's for the cardiovascular systems, like the racing heart, the heart palpitations, sometimes the anxiety that comes along with that. The other big thyroid suppressing medication is PTU, also called propylthyrosol. And this can be used in just a couple of situations, like if methimazole doesn't work well, they could try this instead. Pregnancy. Methimazole is tetragenic, PTU is not. So if they think a woman is going to become pregnant or the first 3 months of pregnancy, this is the drug to use. The reason why it's used much less is because it has a greater chance of lowering white blood cell counts, and it has a greater chance of elevating liver enzymes. Now, methimazole can also cause these side effects, but they're just more common with PTU. Now, one of the big questions people have for me is that they're on these hyperthyroidism medications, and they want to know if they can take it with herbs and supplements. And the answer is yes. You can take the herbs, the supplements, with your hyperthyroidism medication. Now, this is a bit of a team effort at times. So you want to use the guidance of the prescribing doctor with regards to the medications. So we have endocrinologists out there. I'm not trying to take their place for everything that they do. They prescribe medications, they order certain lab tests, and they monitor the progression of the disease. As a naturopathic doctor, I do use certain herbs and supplements that will help control hyperthyroidism, but what I'm really interested is in the underlying cause of the disease. What is leading someone towards autoimmunity or these other triggers of hyperthyroidism? In terms of the criteria to lower medication, if you want to get off of these things, that is going to depend upon your symptoms, your lab tests, and your response to natural treatment. Just like some people are going to respond better or worse to methimazole, some people are going to respond better or worse to bugelweed. But if someone is on a natural health plan, if they're getting better, then you go back to the endocrinologist, they'll look at the labs, they'll look at your signs and symptoms, and they're going to know that it's time to reduce dose. I don't get in the way of what an endocrinologist is doing and tell people how much methimazole to take. And if you're on these medications and you want to get off, my general advice would be listen to the medical doctor in terms of the medications, and then work on your health. And as you get healthier, you just won't need the medications, and then get off of it in a responsible manner. Don't say, I read online that if I go gluten-free and take this supplement, my hypothyroidism is going to go away, and then do that and stop using the medication. Because if this plan doesn't work that well, next thing you know, you're going to have a lot of symptoms. But at the same time, we all have to be our own doctor to some degree, so I hope that the information about methimazole, about how it can induce hypothyroidism, will help people in being able to monitor themselves. So if something is going on that's not right, they can go back to the medical doctor, with the problem. Don't just wait if there's something off, because waiting might cause a lot more problems in the long run. And while you do need to keep symptoms under control, this is a problem that might lead towards a bit of defensive medicine, that someone doesn't want their patient in the emergency room with a thyroid storm. So they might keep them on maybe more medication than ideally is needed. And if that's not being watched, again, go to hypothyroidism, you can become very sick as well, going the other way. In terms of supplements and herbs, this is try to make a simple flow chart. We have 3 general causes, some type of nodule. Look, I personally don't have a lot of experience working with clients who have secreting nodules but don't have Graves' disease. This can be difficult because if it's Graves' disease, you're working on the immune system. If you have some nodule just hypersecreting thyroid hormone, I don't know if it's always practical just to go the natural route at that point, because you really do have some pretty diseased tissue there that needs to be shut down. You can try your supplements. You might have to refer out and have that removed or destroyed. Graves' disease, we're going to consider severity of symptoms, and what my goal to do with clients with Graves' disease is to work on the right supplement plan that those are going to be able to largely control symptoms, so then they can go back to the endocrinologist and have their medications adjusted to something lower. And then we have to look at immune system triggers: diet, allergens, toxicity, heavy metals, parasites. There's lots of things that cause autoimmunity. In the case of acute thyroiditis, my attention will be more on why the body is producing that than Graves' disease, but it's good to know that the antibodies are not elevated, that it is an acute problem, and that it should be able to be controlled in a much more reasonable amount of time. I'm going to go over 2 different theories of what causes autoimmune disease. One is that of embedded toxicity. The idea is that you have some cell and toxins become stuck in it, so the immune system makes antibodies to go after the toxins that are stuck inside of that cell. The antibodies aren't to destroy the cell, but it's kind of like that cell is an innocent bystander, and that the underlying toxicity may be a virus. You'll see Epstein-Barr virus thrown out as a possible cause of this, heavy metals or other toxins. So just again, consider the cell's collateral damage, but that there is some embedded toxicity that needs to be gotten rid of, either through some type of detox plan or antiviral plan. The other big theory is molecular mimicry and leaky gut. The idea is that you might have some microbes in your digestive tract, like some bacteria or whatever, and the proteins on that bacteria look like proteins in different types of cells you have. So maybe you have an amoeba, and your immune system sees the amoeba in the gut, and it creates antibodies, but those antibodies start signaling the immune system to attack the thyroid. So that's molecular mimicry and leaky gut. We see this with other autoimmune diseases as well, such as rheumatoid arthritis, can definitely be triggered by the type of bacteria in someone's gut. This is a good theory, and there are times where, yes, it is a parasite, it is dysbiosis, it is a food allergen. It's not always the case. So this is a useful theory that's applicable at times, and I do look at the gut, and sometimes you see a lot of problems, and when you treat the gut, the autoimmune disease gets a lot better. There are other times when you can run all sorts of stool tests and treat the gut, and that's just not the problem. So again, everyone is different. We don't want to put people in boxes. And if you kind of belong in this box and you're getting the right treatment for it and you're better, great. If you're not in this box, then it just might mean that going gluten-free and doing this parasite cleanse and doing these stool tests, it may not help you. I do often recommend functional stool tests with my Graves' disease clients, and if it shows something, great, we're going to work on that. If it doesn't show something, then my answer is, well, we checked this out, it says things are okay, so now we know what other things to look at. Either way, it's good information. Herbs and supplements for Graves' disease. If someone's on a comprehensive plan, you're going to have certain things for the Graves' disease triggers, whether it's detoxification, antiviral, dysbiosis, parasites, allergens, maybe emotional stress. Unfortunately, each one of these is a big category unto itself, and the actual Graves' disease triggers are going to be different in everyone. So there's no such thing as the Graves' disease protocol for everyone to follow. It really just does not exist. It's a little bit simpler when it comes to just things for Graves' disease symptoms, is that we do have a set of herbs and supplements that generally work pretty well. Nonetheless, these herbs are all different, and they're not going to work the same in everyone with hyperthyroidism. On average, bugelweed is the best herb, supplement, whatever in the world of nature for hyperthyroidism. I see cases where it actually works much better than methimazole. Not everyone, but there definitely are those cases out there. And then paradoxically, there's a few people, not many, but they're out there, where they have Graves' disease, they take bugelweed and they get even worse. So I recommend to people, if you try bugelweed, try just a small amount at first, just make sure you're okay with it. If I'm working with someone inside my office, then I'm doing applied kinesiology muscle tests against all these things if they need it. And if someone does not test for bugelweed, I won't give it to them specifically because I don't want to see it make anyone worse. So I haven't seen any of these negative reactions from when I've given people bugelweed, but I've had people come to me who've used bugelweed before, and every once in a while they said it made them feel worse. Lemon balm is a great cooling herb. It's a strong antiviral herb. It's good for excessive heat and anxiety. Oh, by the way, all these herbs, bugelweed, lemon balm, motherwort, Salicursus, they're all historically like anti-anxiety herbs. Lemon balm, one of the keynote symptoms is excessive sweating, especially with the palms. So I've seen people respond better with lemon balm than bugelweed and just get better mostly by using lemon balm. Besides simply working on the hyperthyroidism itself, we do have that strong antiviral action of it. So the herb kind of takes care of both of those if someone needs some type of antiviral action. Motherwort is historically a calming, relaxing herb. It's also used, for example, for PMS, for cramps, that sort of thing. Motherwort I like as a cardiovascular herb. That's what it's historically used as, for the heart. So if someone has hyperthyroidism with bad heart palpitations, then I'm more likely to say, maybe let's try motherwort in with a formula. Where if someone doesn't have the cardiovascular symptoms, then I probably wouldn't even want to bother with motherwort. Salicursus grandiflorus, also called cactus, this is good for tachycardia. So again, we get the heart symptoms. So if you're looking for a general herbal combination with the heart symptoms, you can just throw all these together. And generally speaking, that's going to be a pretty good combination. Within my office, I have over 150 different herbs. So usually if I have someone with Graves' disease, I will use these to help them control symptoms so they don't need to be on the methimazole. And then I'll try other herbs for the underlying issues, whether they're antiviral herbs like limation or cat's claw, or lymphatic movers like Oregon grape or iris versicolor. We have lots of different options, but in order to know what herbs you need to really treat the underlying issue, that's where it comes to looking for someone you can work one-on-one with rather than just getting advice from an internet video. Other common supplements, vitamin D. We know a lot more about vitamin D now than 15 years ago, so even medical doctors are testing for it pretty routinely. Selenium is a great antioxidant for the thyroid. I give it to people all the time. Carnitine can be used to lower the body's response to excessive thyroid hormone. So if your thyroid hormone is too high and you take carnitine about 2,000 milligrams a day, it's going to make your cells less responsive to that excess thyroid hormone. It's not going to do anything itself to lower thyroid hormone. It just kind of calms down your response. So it's a good supplement for that. Probiotics, again, immune system regulation. Lithium as in the form of lithium orotate, or from Biotics is a company I use where they have like a whole food lithium. This should not be confused with lithium carbonate, which is a prescription drug commonly used for things such as bipolar disorder and schizophrenia. Lithium carbonate is given in doses of 300 milligrams to 1500 milligrams. Lithium orotate is sold in pills about 5 milligrams, so they should not be compared. Lithium does suppress thyroid function. They even know that lithium carbonate, this prescription drug, can cause hypothyroidism. That's a potential side effect. But low-dose nutritional lithium can help. I put down no iodine. I see this all over. People are taking iodine for Graves' disease and hyperthyroidism. The thyroid uses iodine to make more thyroid hormone. So if you already have too much thyroid hormone, you don't need to take more iodine to make even more of what you have too much of. I've seen people come to me taking all sorts of doses of iodine for their hyperthyroidism. I've never seen anyone ever tell me they got better taking iodine. I've seen lots of non-responses. So I'm not saying that it's particularly dangerous if you are taking it. I just look at it as kind of pointless. And I just kind of wish people would stop recommending it for hyperthyroidism unless a compelling reason came out. But I'm not going to recommend that someone take iodine for hyperthyroidism, because I heard people give it for hyperthyroidism without it making any sense to me. Okay, that's it for the video. Thank you for watching. I'm putting up some links to my other videos on Graves' disease and hyperthyroidism, so you can check those out. You can check my website out. I hope this is good, practical, useful information. I really try to educate people and stay away from the fluff. So if you like the video, give it a like. You can write some comments and I'll reply. Okay, bye.